Welcome back to part 2 on the fundamentals of fatigue and recovery. In this video, we are going to be covering the overtraining syndrome, covering concepts of the fatigue continuum, prevalence of overtraining, markers and assessment of overtraining syndrome. The goal in working with competitive athletes is to provide training loads that improve their performance. Athletes may go through several stages within a competitive season of periodized training. When prolonged excessive training is combined with other stresses and insufficient recovery time, decreased performance can result in chronic maladaptations, leading to overtraining syndrome, the acronym OTS. This is where the importance of optimal recovery must be highlighted. Coaches and researchers suggest that enhanced recovery allows athletes to train more, thus improving their overall fitness, technique, and efficiency. In subsequent chapters, we will discuss the different recovery approaches. In the meantime, we need to ensure we have a good understanding of the definition and use of the word overtraining and overtraining syndrome. Overtraining syndrome is characterized by a sport-specific decrease in performance, combined with persistent fatigue and mood disturbances. This underperformance persists despite a prolonged recovery period, which may last several weeks or months. Since no tool exists that identifies overtraining syndrome, a diagnosis can only be made by excluding all other possible influences on changes in an athlete's performance and mood. Therefore, if no explanation for the observed changes can be found, the athlete is diagnosed with the syndrome. Early and unequivocal recognition of overtraining syndrome is virtually impossible because the only certain side of this condition is a decrease in performance during competition or training. However, saying this, the line between under and overdiagnosis of the overtraining syndrome is very difficult to judge. Successful training involves a specific exercise intensity or overload in order to achieve supercompensation, which is a positive adaptation or improvement in performance. It must also avoid the combination of excessive training and inadequate recovery. If the exercise intensity is too low, athletes cannot expect to improve their performance. As a result of an intense training period, or even a single training session that is particularly taxing, they may experience acute feelings of fatigue and decreased performance. If adequate rest follows the training session, supercompensation may result. This process is the basis of effective training programs. However, when the athlete's capacity for adaptation becomes over-solicited through insufficient recovery, a maladaptive training response may occur. Several authors consider overtraining as an inevitable result of training, beginning with overreaching and finally ending in the overtraining syndrome. Since the states of overreaching and overtraining syndrome have different defining characteristics, this concept of an overtraining continuum is probably an oversimplification. Overtraining syndrome results from more than the presence of training errors, coinciding particularly with other stresses. However, as the joint consensus statement of the European College of Sports Science and the American College of Sports Medicine states, these definitions indicate that the difference between overtraining and overreaching is the amount of time needed for performance restoration, not the type or duration of training stress or the degree of impairment. These definitions imply that an absence of psychological signs may be associated with the conditions. Since it is possible to recover from overreaching within 2 weeks, it may be argued that this condition is a relatively normal and harmless stage of the training process. However, athletes who are suffering from overtraining syndrome may need months or even years to completely recover. Intensified training can result in a decline in performance. However, when appropriate periods of recovery are provided, athletes may exhibit enhanced performance compared to baseline levels. In this situation, the physiological responses compensate for the stress related to training. If this intensified training continues, athletes can progress to a state of extreme overreaching or non-functional overreaching that leads to a stagnation or decrease in performance. They will not be able to resume their previous levels for several weeks or months. Overreached athletes in both the functional and non-functional categories can fully recover after sufficient rest. In non-functional overreaching, progress along the overtraining continuum is determined both quantitatively, i.e. by the increase in training volume, and qualitatively, for example, signs and symptoms of psychological or endocrine distress may occur. Although it is possible to recover from short-term, that's functional overreaching, within 2 weeks, the recovery time for non-functional overreaching is less clear. This is probably because not many studies have tried to define the subtle differences between extreme overreaching, which requires several weeks or even months for recovery, and overtraining syndrome, which may take months or even years to overcome. Another consideration is the use of the expression syndrome, which emphasizes multiple factors and acknowledges that exercise, training, is not necessarily the sole cause of this condition. This table illustrates the different training stages that leads to overtraining syndrome. Reports on athletes suffering from overtraining syndrome are mostly case descriptions. This is because it is not only unethical, but probably also impossible to train an athlete with a high training load while simultaneously including other stresses, especially since the symptoms of overtraining syndrome differ for each person. The most cited study on athletes suffering from overtraining syndrome is a paper by Barrett and colleagues in 1985. The authors report clear hormonal disturbances in long-distance runners. In this study, performance was not measured. The authors declared that the athletes recovered hormonal function after 4 weeks. This might indicate that the athletes were in a state of non-functional overreach rather than suffering from overtraining syndrome. In other studies, there have been reported differences in glutamine in overtrained athletes. Again, this study gives no clear indication how performance decrements were registered. In another reported case study on a cross-country skier who, after several months of intensive training, up to 20 hours a week, showed increased fatigue, reduced performance, and disturbances on psychometric tests. After ruling out other illnesses, this athlete was diagnosed with overtraining syndrome. In order to investigate changes in the autonomic nervous system, heart rate variability was recorded in this athlete. They registered a shift towards increased heart rate variability, particularly in the high frequency range, along with a reduced resting heart rate. This indicates an autonomic imbalance with extensive parasympathetic modulation. Although it is not clear how performance decrements were measured, the authors report that the athlete needed 8 weeks to recover. The border between optimal performance and performance impairment due to overtraining syndrome is subtle. This applies especially to physiological and biochemical factors. The apparent vagueness surrounding overtraining syndrome is further complicated by the fact that the clinical features are varied from one athlete to another. Factors are non-specific, anecdotal, and numerous. Probably because of the difference in the definition used, prevalent data on overtraining athletes are dispersed. Studies have reported that up to 60% of distance runners show signs of overtraining during their careers, whilst data on overtrained swimmers vary between 3 and 30%. If the definition of overtraining syndrome as stated previously is used, the incidence figures will probably be lower. Therefore, athletes should only be defined as suffering from overtraining syndrome when a clinical exclusion diagnosis establishes the condition. Since overtraining syndrome is difficult to diagnose, it is therefore important to try and prevent it. Moreover, because overtraining syndrome is mainly due to an imbalance in the training recovery ratio, i.e. too much training or too many competitions and too little recovery time, athletes should frequently record their training load using retrospective questionnaires, training diaries, physiological screening, and through direct observation. A variety of measurement tools have been developed to accurately monitor training load and to quantify recovery rate. These measurement tools should be non-invasive, sensitive to change, and easy to administer. One such tool is the measurement of recovery heart rate. It has been shown that the chosen exercise intensity of a submaximal test should elicit a heart rate between 85 to 90% of maximum heart rate, because the lowest day-to-day variations were found at this intensity. From test to test, a change in heart rate recovery of more than 6 beats per minute, or the change in submaximal heart rate of more than 3 beats per minute, can be regarded as a meaningful change under controlled conditions. These changes can be caused by an improved or decreased training status, or by the accumulation of fatigue as a result of functional overreaching. A variety of other measurement tools exist, such as the resting heart rate, the Profile of Mood States questionnaire, the Daily Analysis of Life Demands for Athletes questionnaire, and the Total Quality of the Recovery Scale, the Total Quality of Recovery Scale. These have been used to monitor and predict changes in training status and performance, but none have been able to consistently monitor and predict changes in these parameters. Ratings of perceived exertion, or RPE, offer a valuable determinant of impeding fatigue during exercise testing. And training, they are widely accepted as an effective tool for prescribing aerobic exercise intensity. Foster and Associates in 1996 introduced the concept of session RPE, in which an athlete subjectively estimates the overall difficulty of an entire workout after its completion. Subsequent studies have noted that session RPE may prove useful in evaluating recovery across exercise sessions, but more work is needed to determine the precision of this measure and to further elaborate on both the physiological and psychological factors influencing session RPE. Most of the blood parameters, such as blood count, C-reactive protein, creatine kinase, urea, creatinine, and liver enzymes, are not capable of detecting overreaching or overtraining syndrome, but they are helpful in providing information on the actual health status of the athlete and are therefore useful in the exclusion diagnosis. Overtraining syndrome can be understood partly within the context of the general adaptation syndrome. Concomitant to the stress disturbance, the endocrine system is called on to counteract the stress situation. The primary hormone products, adrenaline, noradrenaline, and cortisol, all serve to redistribute metabolic fuels, maintain blood glucose, and enhance the responsiveness of the cardiovascular system. Repeated exposure to stress may lead to different levels of responsiveness to subsequent stressful experiences, depending on the stressor as well as on the stimulus paired with the stressor. However, simply knowing the effect of a hormone is not sufficient to understand its actual role in metabolic control. Each hormone has a predefined exercise-induced pattern. When investigating hormonal markers of training adaptation, it is therefore important to target specific hormones for their informational potential and to synchronize their sampling in accordance with their response patterns. Research findings support that athletes experience maladaptive training and performance adaptation problems seem to suffer from a dysfunctional HPA axis, that's the hypothalamic pituitary adrenal axis, response to exercise, which results in an altered hormonal response to intense training and competition. When investigating elite athletes, the HPA axis is believed to offer valuable information about an athlete's state of adaptation. It is important to note that these tests are time-consuming and expensive to conduct. General agreement exists that overtraining syndrome is characterized by psychological disturbances and negative affective states. It has been suggested that although the psychological processes underpinning overtraining syndrome are important, the phenomenon occurs only when these psychological processes are combined with a negative training adaptation. Sustained failure to adapt to training generates excessive fatigue. Training when the body's adaptivity is lost leads to overtraining syndrome. Athletes then suffer from a neuroendocrine imbalance and typically experience a noticeable drop in performance. When athletes suffer from overtraining syndrome, they typically experience chronic fatigue, poor sleep patterns, a drop in motivation, and episodes of depression and helplessness. Not surprisingly, their performance is considerably impaired. Several questionnaires, such as the Profile of Mood States, POMS, Recovery Stress Questionnaire, such as the REST-Q Sport, and Daily Analysis of Life Demands of Athletes, have been used to monitor psychological parameters in athletes. Other tests, such as attention tests, which is, for example, a finger pre-cueing task, or neurocognitive tests, also serve as potential tools to detect subtle neurocognitive disturbances registered in overreaching or overtraining syndrome athletes. It is important to register the current state of stress and recovery and to prospectively follow the evolution for each athlete individually. The great advantage of psychometric instruments is the quick availability of information, especially since psychological disturbances coincide with physiological and performance changes and are generally the precursors of neuroendocrine disturbances. In overtraining syndrome, the depressive component is more expressed than in overreaching. Changes in mood state may be a useful indicator of overreaching and overtraining syndrome. However, it is necessary to combine mood disturbances with measures of performance. The use of training logs isn't new. In research, a daily training log during an entire season in swimmers was implemented to detect staleness. The distances swum, the dryland work time, and subjective self-assessment of train intensity were recorded. In addition to these training details, the swimmers also recorded subjectively ratings of quality of sleep, fatigue, stress, and muscle soreness, body mass, early morning heart rate, occurrences of illness, menstruation, and causes of stress. Swimmers were classified as having overtraining syndrome if their profile met 5 criteria. 3 of these criteria were determined by items of the daily training logs: fatigue rating in the logs of more than 5 on a scale of 1 to 7, lasting longer than 7 days. Comments in the page provided in each log that athletes felt they responded poorly to training, and a negative response to a question regarding the presence of illness in the swimmer's log, together with a normal blood leukocyte count. Other methods have looked at ways to quantify training loads as a product of the subjective intensity of a training session using session RPE and the total duration of the training session expressed in minutes. If these parameters are summated on a weekly basis, it is called the total training load of an athlete. The session RPE has been shown to be related to the average percent heart rate reserve during an exercise session and to the percentage of training session during which the heart rate is within blood lactate derived heart rate training zones. With this method of monitoring training, researchers have demonstrated the utility of evaluating experimental alterations in training and have successfully related training load to performance. Other factors such as weekly training load, daily mean training load, training monotony, that is the daily mean divided by the standard deviation of the training load, and strain, which is the product of the weekly training load and monotony, can be used to monitor training loads. Noting illness and injury, there has been shown to be a relationship between spikes in the indices of training and subsequent illness or injury. Overtraining syndrome is reflected in much of the research on overreaching and overtraining by a lack of consistent findings. A reliable marker for the onset of overtraining syndrome must fulfill several criteria. The marker should be sensitive to the training load and should ideally be unaffected by other factors, for example, diet. Changes in the marker should occur prior to the establishment of overtraining syndrome, and changes in response to acute exercise should be distinguishable from chronic changes. Ideally, the marker should be relatively easy to measure and relatively inexpensive. However, none of the current available or suggested markers meets all of these criteria. When choosing several markers that might give an indication of the training or overtraining status of the athlete, one needs to take into account several possible problems that might influence decision-making. Test reproducibility, test specificity to the sport, lack of adequate baseline data, food intake, diurnal and seasonal variations of the hormones are all important factors that need to be considered. In female athletes, the hormonal response will depend on the phase of the menstrual cycle. Hormone concentrations at rest and following stimulation, such as exercise as an acute stimulus, responds differently. With respect to using psychometric data, always needs to be compared with the baseline status of the athlete. The differences between self-assessment and the questionnaires given by an independent experimenter and the timing of the mood state assessment are also important considerations. That's all for this video. With what we've covered, we now have set ourselves up with the understanding of the important concepts that should be considered in exercise training, recovery, and performance. Join us in the next video where we will look at preventing overtraining.